father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Gani because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone, and welcome to a fresh episode of Ask the Pediatrician Hour. I am Bimi Solavoide. I am here today to discuss with us another important topic that has to do with the health of our children. So thank you so much for joining me on whichever platform you're joining on. I want to welcome those of you who are joining us from Facebook, Ask the Pediatrician Facebook group, Facebook page, and all our other Facebook groups. You're warmly welcome. And for those of you also joining us on Fresh Waves Radio Facebook page, thank you so much for joining us today. I also want to thank those of you joining us from Instagram Live, and those of you are watching us also on YouTube channel ATP TV. You're all welcome. A big shout out to also those of you who are listening on Fresh Waves Radio and those who are listening on Access to Me ATP podcast. Thank you so much. Whichever platform you're joining us from, you're welcome to ATP Hour. This program is brought to you by Ask the Pediatricians Foundation. As ATP, we are committed to the health of our children globally, but especially in sub-Saharan Africa, where most of our children still die from preventable causes. And what we do is to provide health education, information through all our social media platforms. And ATP Hour is our teaching platform where we tend to look at important topics and then we address them. Okay, so this is April. April is the Autism Awareness Month. In fact, the 2nd of April every year is recognized worldwide as what we call the World Autism Awareness Day. And so that is why today I'll be talking more about autism. Obviously, it's something I talk about every year. And so on the 2nd of April, that was just a couple of days ago, I asked our members to ask me any questions they have about autism, and I got several questions across all the platforms, and I believe that some people who are not on our platforms will have similar questions as regards autism. So today, even though I'm still going to talk about autism, I'm going to approach it as a Q&A session, as a live Q&A. And all these questions I'm going to be answering today, these are questions that were asked live, and I've not edited them. So I just copy them the same way they were asked. So some of them may look like repetition of the same theme, but at the end of the day, we'll be able to address most of the important issues that have to do with autism. And if you still have any questions after the live session, not to worry. You can always post your questions on Ask the Pediatricians Facebook group from Mondays to Saturday, and we'll be there to answer your questions. So if I'm able to address your question today, great. However, if you still have any questions that I have not addressed or you're not yet satisfied, at the end of the program, just go over to Ask the Pediatrician Facebook group and you can post your questions there. Remember that you can also watch all the past episodes on the same platform that you are watching or listening to me right now, especially on our podcast for those of you who love to listen. And you can also watch on our YouTube channel, and they are always also available on our ATP Facebook group and pages. And also, if you want to read, you can head over to our website, www.askthepediatricians.com, and you can read these topics as well. And in addition to reading, you are welcome to ask your questions also on the website, and we'll address them as well. But immediate, faster responses will be getting from our Facebook group. So thank you so much for joining me today. And I'm just going to go straight into the I have that somebody has written and I've just copied them. All right, so let's start. But let me just remind us a little bit of introduction first about autism, because I'm sure I got a lot of questions. What is this autism? It's like a word that everybody now seems to know. Everywhere you go, you hear autism, autism, and a lot of people are wondering why autism, autism. Uh, in this program. Just to say that, by way of introduction, autism is a neurodevelopmental disorder, and I'm going to break that down. When we say something is a neurodevelopmental disorder, it is neuro, it has to do with the brain. So it's a condition that has to do with brain. It's developmental, it means it's been present from the time a child has been born, and as they're developing, that is when you begin to see the features of autism. So somebody do not develop autism when they become adults. They've always had autism when they were younger. Even sometimes it may not have been recognized, but they've always had it. So it's a neuro, something that has to do with the brain, and it's a developmental disorder. That is the first thing I like to say. And when we say it's a neurodevelopmental disorder, that has to do with people who have autism have difficulties with certain area or aspects of lives. They have difficulties with what we call communication, social communication especially. And then they also have what we call difficulties with social interaction, interacting with people, responding to people, doing back and forth. And then they may have what we call repetitive and some restricted kind of behavior. They have peculiar way of how they want things to be done, how they see the world. So, and people who are not on the spectrum may not understand why those who have autism, have to do their things that way. So that is a simple way to define autism. I don't want us to get confused about so many medical jargons and all that. But simply speaking, autism is a neurodevelopmental disorder, and people who have autism tend to struggle with social interaction, social communication, and they may have some peculiar behaviors that they show, and that is how we know that they have autism. Autism is still a disability. It is one of those disabilities that doesn't show on the face, and so people tend to, when people talk about disability, we tend to think of somebody in wheelchair, maybe because most of the time when they represent somebody who have a disability in a picture, in a book, most time they just show somebody who is on a wheelchair, and everybody, when they say that, oh, they know that that's a disability. However, autism is one of those disabilities that you don't see it written on the person's face, and you may not know that they have autism at all until you now begin to talk and interact, and then you may begin to see some traits. So it is one of those hidden, sometimes very hidden disability that many people may not know about. So that's just to tell us what autism. So it has to do with the brain. It has to do with the way the brain is wired, a difference in the brain. So that is what autism is about. And there are several features of autism. I guess it's one of the questions people are going to ask me, so maybe I should just leave it and dive into the questions, but I just want to just give an introduction. And autism is rising. When I was in medical school, we used to say, that's over 20 years ago, we used to say that autism is occurs in 140, because then that is in the United States. After most other countries like Africa, where I trained, we don't tend to have data about how many people have autism. We don't even know who have autism, who don't have autism, because sometimes, because in Africa, disability is a thing that people tend to hide. We don't want people to that. We don't want labels. I know. So it was a change for me when I went up, to developed countries, and people are really coming like they want an assessment, they want a diagnosis. Whereas where I come from, people, even when you're seeing it and you're trying to tell them, I think there's something here, we reject it in Jesus' name, and we don't want those labels. However, so in the United States, like I was saying, over 20 years ago, when I was training as a medical student, I remember we used to say autism data 1 in 140. Now, just before I came up, I checked the data now. It is 1 in 36. 1 in 36 children under the age of 8 have autism in the United States. That is a lot. In the UK, we say 1 in 100 people have autism. So we have about almost 1 million people with autism in the United Kingdom. So, and I'm sure the figures in Africa will be as similar, or maybe we don't have the data, but definitely I see a lot of parents who are recognizing their children have autism, because now everybody is reading. Thank God for internet, thank God for when the information is available. Parents are also checking, and even you see some of the questions I'm going to answer, people are, see, I see this, I see that, what is it? And then they go through Google, thank God for Google, and then people are going to say autism. So we are more alert, we are more aware of autism. So and people kept asking, why are we having more cases? Is it that it is rising truly, or is it that we are becoming more aware and able to diagnose autism better? I think the answer is the two. I think we actually having, through increase in cases of autism, we are also maybe more aware. Everybody seems to know what autism is, and we're definitely seeking help, and people are getting diagnosed better. So I think that is what is happening. So it is something very common. So something that affects 1 in 100 people, for example, in the UK, 1 in 36 children under the age of 8 in the US, that is a very common condition. So it is something we all need to know about. So I think that is enough for my introduction. And now let's go into discussing the questions I have. So the first question I had, my son is ASD level 3. And for those of you who don't know, ASD is the abbreviation for autism. So instead of saying autism spectrum disorder, which can be quite a mouthful, we just say ASD. Sometimes we say on the spectrum, so those are terminologies we use. We're still talking about the same thing. And some people like to use the word neurodivergent and all that. I don't think, let's just stick with autism spectrum disorder. Some people also say autistic spectrum disorder. We're all talking the same thing, just semantics. And then when we make diagnosis of autism, we tend to qualify it, because autism is a spectrum. When we say something is a spectrum, it means it varies. And we used to say, there's a cliche that says, when you've seen one person with autism, you've actually seen one person with autism, because the next person with autism you're going to see will be different from the one you saw earlier. So autism is different. Every person on the spectrum is different. So we have a huge spectrum. We have people on the mild end of the spectrum who most often are not even diagnosed with autism. So a lot of the time when I see children in my clinic, the parents will keep telling me, oh, there's somebody in the family who is also like this, but he doesn't have a diagnosis, but we can see the traits. We think the person is on the spectrum. So people tell me that all the time. So there are a lot of people who have autism who have never been diagnosed with autism. They tend to be on the mild end of the spectrum. They are talking, they are functioning, but people will say that they are just different. They are just, peculiar in their own thing. And people can see some of those features. Some parents will tell me, some of the things I'm seeing in my own child now, I actually had this when I was younger. And even say now, I'm still like this, I'm still like that, I'm still like this. And they are thinking, I think I actually may be on the spectrum myself. And I've seen some of my parents who actually went for their own autism assessment as an adult, because they can see the same traits in themselves. But when they were younger, they were never diagnosed with autism. So we have people on the mild end of the spectrum, people who just, sometimes people think they're just shy, they're just introvert, they're just into themselves. Some of them may be on the spectrum. And and we don't even know when the shy and socially awkward ends and autism begins. And then we have the other end of the spectrum, which is the one everybody recognizes. Even the mother would tell me, my child is autistic. These are children who are not talking, who are you know in doing repetitive behavior, maybe banging their head on the wall, walking on their tiptoes, spinning in circle, what we call the classic autistic child. So we have them on the other hand, non-verbal, very repetitive, lots of meltdowns and all that. So it's a huge spectrum. And in between, you have people who are professors, who are doctors, who are on the spectrum, and you have people who are completely dependent. Like one parent was telling me, a 12-year-old, a 23-year-old, you're going to see those questions. They are still completely dependent on them. So we tend to classify autism, but whether they're on the mild hand or the other hand, you are still on the spectrum. So everybody's on the spectrum. But so that we can kind of recognize how much, so we kind of classify people by how much support they need. So we talk about level 1, level 2, and level 3 support. So level 1 support means you need little or no support whatsoever. And these are the people that are on the mild hand of the spectrum. Most of them are very intelligent, they're doing so well. In the olden days, we tend to call them high functioning, autistic, we tend to call them Asperger's. We don't use those terminologies anymore. I'm not going to go into the reason why we don't use them anymore, but we don't use high functioning, Asperger's, all those things, we don't use them anymore. Now we talk about everybody is on the spectrum, everybody has ASD, but we can qualify it by, can the person talk? Any language impairments or no language impairments? That's the first thing. Does the person has additional diagnosis of maybe learning disability or intellectual disability? Or for the children under the age of 5, we tend to talk about global developmental delay. So we qualify it with that. We can even qualify with whether there's any other underlying diagnosis that we've been able to find. Maybe we're able to find a genetic syndrome like Fragile X syndrome or something that can explain the autism. So we also mention that as well. So that is how we qualify the autism. And then we finally will qualify by the level of support that the person needs. So somebody who needs minimal support to function, we call them level 1 ASD. And then we have people who are level 2 who will need some moderate support. And then you have level 3. These are people that really need intensive significant amount of support, or else they won't be able to function at all. So when this mom said my son is ASD level 3, she's saying that her son has quote unquote severe autism. This child needs lots of support. We don't also tend to use the word mild, moderate, severe autism. People tend to ask me that, is my child autism mild? And I tend to say a lot of people saying, oh, my child has mild autism. We try not to use that terminology, but we talk about the level of support the child needs. So level, because sometimes somebody may look like what has mild autism in the sense that this person is talking, the person is intelligent, but the person may have severe needs for support around behavior or even mental health issue or anxiety. And if you say they are mild, you give the impression as if they don't need the support, but they may actually need more support than a child who has what may look like severe autism because they are non-verbal and they don't even have eye contact, they're very repetitive, but they may not need, apart from the fact that you need to meet their dependence on you, but they're otherwise happy in their own life, in their home world. So we try to move away from that so as not to miss out on the support that people will need when they're on the spectrum. So level 3 just means the person needs significant loads and loads of support. And so this mom is asking, what can we do to improve the level? So when it comes to the level of autism, we tend to say they are kind of static. So in other words, somebody who is level 3 very rarely will move down to level 1. It can happen, but very rarely, because obviously it's a developmental disorder. So children are growing, they are changing all the time. So, but whether level 1, level 2, or level 3, the most important thing is that whatever needs that child has, that child needs to be supported. So when we're making diagnosis of autism, it is not just to put a label on the child. One of the things we normally also comment in our report, for those of you who go to the appropriate people to do the right assessment, to do the right report, because there are a lot of people who do what they call assessment, but they don't have an idea what they're doing. But a proper assessment, we always talk about the strengths of the child. We also talk about the weaknesses. So what this means that what are the needs of that child? Because like you will see later, we don't have any specific treatment for autism. We don't have a drug for autism. So we address the needs of the child. So what are the needs of this child? Does the child needs communication? So communication is speech therapy. Some children will never talk, so we give them alternative form of communication. It could be picture cards, it could be sign language. The most important thing is that the child is able to communicate, and that will reduce the frustration level. So that is meeting the needs. So some children have a lot of sensory difficulties. Sensory, be sensitive to loud noises, they may be sensitive to the lights, they may be sensitive to food textures, all things like that. So we try to work around either avoiding things or giving alternatives. So occupational therapists may come in there and all that. So there are different kind of therapies. Some children have a lot of behavior issues and all that. So behavior therapy will come in. So we kind of address the needs of the child. We are not focusing on the autism per se, but what are the area where the child is struggling, and what are the area of this child's strengths? We can use that when we're doing those therapies to meet the need of the child. So that is how we support children on the autism. So we talk about managing autism. We don't talk about curing autism. So once we give an autism diagnosis, it is for life. We don't take it back, and that's why we don't rush to give it, and that's why we always look for enough evidence before we give a diagnosis of autism. So I'll stop there and go to the next question. Okay, the next question: how do we stop hyper in autism? Yeah, so a lot of children who are on the autism spectrum sometimes can be very busy. I like to use the word busy rather than hyper. But that is what parents mean when they use the word hyper. In other words, they don't sit still, they're always moving. Number one, there is some level of hyperactivity that is normal for every child, especially at a certain age. Let's start from that, because most times we as adults we tend to sit still, but for children they tend to move, and it is some level of movement and not being sitting down like a cucumber is acceptable, but there's a level of hyperactivity that is part of autism. It could be what we call part of the sensory, the vestibular, the fact that the children just have to move, they just have to run around, or it's a way they regulate their body, it's a way they interact with the environment. But there's also another level of hyperactivity that even for autism it is too much. And then we're now beginning to talk about a child who actually has an additional diagnosis of ADHD, attention deficit hyperactivity disorder. So we can have some level of hyperactivity, if you like, or busyness that is normal even for a 3-year-old, 2-year-old. They're supposed to move around, but by the time they're about 4 or 5 years, expect them to be sitting still in the classroom and not getting up from their chair. And then, so there are some children who will still get up, who will do all that, which could be part of the autism diagnosis. And there are some children that even with the allowance for the autism, it is too much. They can't sit still, they can focus, they make silly mistakes and all that. Then we're talking about, does this child have an additional diagnosis of ADHD? Why am I stressing all this? It's important to know which level that child is. Is it just normal hyperactivity, which is accepted, which you just need to accept? Sometimes we just give the children an opportunity to go and bounce on the bouncing castle, just drain off those excess energy, make sure we are not giving them food that increase too much of sugar in the blood that will also make them hyper. So we work on all that. But if we're doing all that, giving them reminders, putting them in front of the class, helping them, giving them time breaks to burn off energy, and they're still struggling, then we want to have an assessment for ADHD, and we may want to give ADHD behavioral support and medication. So I guess the solution to this question is you have to see a pediatrician, probably a developmental pediatrician, so we can figure out which of the three options the child is. Is it just the normal hyperactivity for age or for allowance for autism, or does the child have ADHD, and do we need to treat the ADHD? So that is so the doctors will be able to assist and tell you which one to do. All right, so how do I help my son to sit still for a long time? I guess this is exactly the same question I just answered about hyperactivity. So a child who cannot sit still is, that is also hyperactivity, and the answer is still the same. And then, but in addition, it's how to stop screaming and shouting. So behavioral issues is a very common thing in children on the spectrum. And the way we manage behavior is to know why the behavior is there. Why is this child screaming? Why is this child shouting? Okay, sometimes children do do that out of frustration, especially for children who don't have a means of communication, children who are not talking. You can imagine going to a place where you're speaking and nobody understands you. It can be quite frustrating. So sometimes for children on the spectrum, it is that frustration. So what we do is we give them ways to communicate, sometimes teaching them sign language, sometimes giving them picture cards, what we call PECs, to use and all that. So sometimes we find that we should address that communication frustration, then the children will do less of the screaming and shouting, because sometimes they are trying to tell us something and they can't get it out, and so they act it out, and that is why we have those behavior. For some children, it could be sensory seeking. Some children just, they just want to do those things to regulate themselves. So they have what we call emotional dysregulation. So sometimes it's about trying to give them breaks where they can do it in a more controlled version, maybe more acceptable way. So those are some of the things our behavior therapists, play therapists help the children, to do. So most of the children who have this kind of behavior, they may need form of behavior therapy and support. So some children, it could just be that they are hot, they're tired, and it's just about figuring out why and trying to address it. Some children, it's because, maybe they have these rigidity, things that this is how they want their things to be. They just want to eat with a blue plate, and you give them a pink one because you don't know, and that is what is going to trigger it. Then once you figure it out, it is because the child wants to have their plates, or it could be as simple as maybe they don't want any part of the biscuit broken, and it's already broken. And so it takes time sometimes for parents to figure this out, but over time we begin to learn the children, begin to know this is how the child wants this. This is the food the child wants in the morning. Some children eat the same thing every day. So you have to do it. So once we begin to work it out, then those behavior will be less and frustration will be less. This is where our therapists come in and they can provide support for us. Okay, the next question I have, which I have this question so much yesterday, not yesterday, yeah, it was yesterday, but that was on the 2nd of April. Is ADHD and ADD the same thing as autism? The answer is no. ADHD, already for those of you who have been listening, you will notice I've already talked about ADHD a bit. ADHD is a different diagnosis, and autism is a different diagnosis on its own. One of the challenges we face as developmental pediatrician is we tend to have multiple diagnoses in one child. In fact, it's very rarely we give one diagnosis. Sometimes our diagnosis is a long list, and I'm talking of long list. Sometimes we're writing our diagnosis and we're still writing a whole page of diagnosis in the same child. Yeah. So in developmental pediatrics or community pediatrics, for those in the UK, we tend to have the same child having multiple diagnoses. So the same child can have ADHD, the same child can have autism, with that same child can still have learning difficulties, that same child can have hearing impairment. So sometimes you begin to list so many things and it can be very frustrating. And I think for people who are like parents or non-professionals, some of those things look alike. So, for example, I've said that even a child who is on the autism spectrum can be hyperactive, but there's a level of hyperactivity in autism that is different from the hyperactivity in ADHD. But there are differences, and that is where the professionals come in. So we know how to differentiate autism and differentiate it from ADHD. But the truth of the matter is that the same child can actually have the two of them coexisting. In fact, coexisting, or what we call comorbidities, when you have multiple diagnoses in the same child, is the norm, is the rule in developmental pediatrics rather than the exception. So, which is what make it more frustrating for parents. So I see a lot of parents will come to me, I think it's ADHD, and then some will say, oh no, I think it's autism, and then I'm thinking, I think it is both of them in the same child. So, but that is our job to figure it out, which is why it is important that we see the professionals for assessment. Don't self-diagnose your children. If not, we're going to make these mistakes all the time, and I see it all the time. So please, let's not do it on our own. Let's see the professionals who are trained to do this assessment, because of unlike malaria, infections, pneumonia and stuff like that, we don't have blood tests, we don't have x-rays to do for this kind of autism or ADHD diagnosis. We do it by assessment, looking at the child, asking questions from you, from the teachers, observing the child. Then we have what we call diagnostic criteria, checklists that we take So the child take A, B, C, A one, two, three. Okay, then the child has the diagnosis. Unfortunately, some children will have one or two out of those criteria, but because they don't have all the others, even though they look like they have it, but they still don't have that diagnosis. So it's a little bit kind of sometimes difficult to explain. So that the fact that your child doesn't have eye contact does not mean the child has autism automatically. No, there are a lot of people who don't give eye contact and they still don't have autism. So it is important for us to know that there are many more things that we look out for as the professionals to make those diagnoses. So bottom line, ADHD and autism are two different diagnoses. All right. At what age can someone detect that his or her child is autistic? Very important question. The truth of the matter is, um, there is no particular time. I've seen parents come to me and tell me they know that their child is autistic from the age of 6 months. Yeah, I've seen actually for parents who have already had a child with autism before, the second child who is going to have autism in that family is going to be diagnosed like like before 1 year because the mother is very alert. Even what people will not even see, like the fact the child doesn't like to be carried or the child doesn't like to be cuddled and all that, they are picking up on it. So some parents are very sensitive and they can pick it up early. So I've seen parents come to us as early as like before age of 1 year, they can already see all the signs in the child. But majority of us will tend to pick up autism from the age of about 2 years, so that's about the time. The signs may have been there, but most diagnoses tend to occur from between 2 and 3. The American Academy of Pediatrics recommends that we screen all children for autism at between 16 and 30 months. We should screen all children, all children. Unfortunately, even in America, where that rule has been passed, it doesn't happen. Now, talk less of us in Africa. But so what people do is that if parents like in the UK, if parents have concerns, when the officers go for their what they call their routine developmental surveillance, where they do their SODs, that's 15 months, 27 months, they just do all those checks in those countries. Unfortunately, we are also trying to introduce this in Nigeria so that when you go for your immunization at 9 months, 15 months, our nurses, our healthcare workers, they can do those checklists for us and see whether your child as autism or as features, traits. They are only doing what we call screening. It's a surveillance thing. They are only just checking. They can't make the diagnosis at that point. But if they are seeing some little signs, then they can refer you to the developmental pediatricians for the detailed evaluation so we can now make the diagnosis. So we can detect autism at any time, but sometimes, most commonly from the age of 18 months, 2 years, that is when we begin to see the signs. And of course, we go through the assessment, which may take another 6 months, 1 year, and then we make our diagnosis. However, there are people that are not diagnosed even until they are adults. So I've seen I've seen quite some people who told me I was missed in primary school, secondary school, but when I was in college or university, I noticed I was different, and I went for an assessment, and I have autism. I saw a parent recently whose child is undergoing an assessment for autism with me, and the mother told me I just got diagnosed myself 2 months or 3 months ago. So the mother is getting diagnosed. She's 26 or 27, while the child, who is about 4 or 5, is also getting diagnosed at the same time. So autism can be diagnosed at any time. It depends on when begin to see the features and when somebody begins to think about it. But for children who tend to be on the moderate, the other end of the spectrum where they have additional needs, we tend to see them earlier. But for children who are on the milder end of the spectrum, sometimes they tend to go under the radar and people will not pick it up until they are adults. So, but we can diagnose autism anytime, but usually from age of 2. All right. Somebody saying, is it true that autism is diagnosed from 3 months? Very, very unlikely that we're going to diagnose autism from 3 months. Some mothers are very super sensitive, like they are telling me they can see the signs as early as maybe 3 months or 6 months. But even the fact that you saw traits or signs does not mean the child has the diagnosis. So the child needs to tick certain number of criteria, and based on the number of criteria that child needs to tick, we will not be able to do the diagnosis at 3 months. So most of the time, like I said, we tend to diagnose children around the age of 2 or 3. It doesn't mean the parents have not seen the signs, but with the pediatricians, we'll not do that assessment. We really don't want to do assessment below the age of 2. We can, but we tend to wait, because sometimes we are sure, is it just that the child is slow with the development, or is it that the child is actually having autism? So sometimes we give them that grace, and there's a level of developmental age that we can't separate autism from global developmental delay. In fact, below the age of 18 months, it is difficult for us to separate, is it just autism, is it global developmental delay? So we tend to wait, and then usually by the time they are around over 2, it becomes to be clearer to us that, okay, yeah, this is more of autism, or this is more of global developmental delay, or it's both of them in the same child, and then we are very sure. Remember what I said, autism is a lifelong diagnosis, so it is something once we give it, we don't take it back. So we're never in a hurry to give a diagnosis. We rather support the child. Whether we give a diagnosis or not, we will just try and be meeting the need of the child. The child not talking, speech therapy, the child have sensory issues, occupational therapy, the child is having difficulties with this, maybe behavior therapy. We work on supporting the child, label or no label. That is more important. So I want parents who are here to know that that is the most important thing. You don't need a label for your child to get support. The most important thing is for the child to have support. Yes, it's okay to have the labels, but the label is not the most important thing. The most important thing is that the child get the right support. And sometimes we prefer to give that support, actually for these very young ones, 1-2-year-old, we give them support first. And then by the time we're not doing our assessment, if we are giving support for 6 months, 1 year, and the child is still really struggling, then we're more convinced of our diagnosis rather than just giving the label first. All right. Somebody said, what's the difference between speech delay and autism? Very important. These people asked me these questions several times on the second, because most parents tend to focus on the child's speech. And I think that is actually what worries parents most. Is the fact that the child cannot talk. They are not even worried about they are not worried so much about other issues, behavior and all that. But if a child is not talking, it just gets its parents a lot. So a lot of our parents, especially in Africa, when our children are not talking by the age of 2, people tend to say, oh, don't worry, the child is going to talk. When I first write my article on autism, which is still available on our website, I really went into that. That's the issue we have. So most parents, bless their hearts, they always know something is wrong. Especially my mothers, they always know. They always know, because mothers are the best developmental pediatricians in terms of they are doing developmental assessments all the time. Tell me how they do it. They are always comparing their children to the other children who are born at the same age. That is developmental assessment, because what do we do in developmental assessment as developmental pediatrician? We know what is normal. This is a normal 9-month-old should crawl, 1-year-old should walk, this and that. Then when you bring your child to us, we just see whether your child is doing what we expect the child to be doing at that age. That is developmental assessment. That is what mothers do all the time. So they remember all their friends' children, all the cousins of the child, children that were born around the same time. They all go to the same church, the same Sunday school, the same school. And they say that, oh, this person is already crawling. Why is my own not crawling? This one is already saying 3-4 words. Why is my own not saying anything? That is developmental assessment. So mothers always know when something is wrong, and they have concerns. Sometimes which is why we started asking pediatricians. They ask experienced mothers, they ask fellow neighbors, and those ones tell them, don't worry, it's because it's a boy. Boys are lazy. That's why they don't talk on time. It's because it's the first child, it's the only child. There's nobody they are going to talk to. Oh, it's because we are living in a country where they speak a different language. People will give excuses why that child is not talking. And they will just tell the mother not to worry, and they will reassure her. And some mothers actually even go further, and they don't talk to parents only, they go to the doctors. And sometimes my colleagues, we also feel the mothers. So people come to us and we just tell them, I've been to the hospital. Mothers tell me that all the time. I don't make these things up. So mothers tell them, I went to the hospital. The doctor said, oh, they said there's nothing wrong with my child, and I should just go home and relax. This is a 3-year-old who is not talking. There is something wrong. Okay. So most time I say that, thank God people now hacks on ATP and we can help you to know what is right and all that. So people just get reassured, and mothers wait and then wait and wait. Okay, they say the child will talk by 3. Some people will even tell you, I didn't even talk until I was 4 years old myself. I didn't talk until I was 5 years old. All those kind of stories. And, we relax. But what we are missing is what we call the early intervention. There's early intervention. I'll talk about brain development in children. 90% of the brain development in children happens in the first 5 years of life. That period is so crucial. Any child who has developmental issues, we want to address it in the first 5 years. The brain is still plastic, the brain is still growing. That is the best time to do therapy. So, which is why in some countries, in advanced countries, because sometimes there's a long waiting list for assessment and all that, we don't need to know why your child is not doing anything. We provide support. The child is not talking, speech therapy, end of story. We don't need to say this is the cause of it, this is not the cause of it. Now let me answer this question. Speech delay is just a description. It's just saying the child is not talking according to what we expect for the child's age. So I always give you the rule of fingers. 1-year-old, single words, one words, single words. 2-year-old should be combining 2 words together. 2-year-old combining 2 words together. 3-year-olds combining 3 words together to form sentences. That is 3-year-old. This is just a simple aid de memoire, just for you to remember. A 4-year-old should be talking like an adult. A 4-year-old should be able to have a conversation with a stranger, and they should have no difficulty understanding a 4-year-old talking with complete grammar, correct grammar, complex sentences. That is what we expect from a 4-year-old. So if your child is not doing that, single words, no single words at 1-year-old, no combination of 2 words phrases at 2-year-old, no combination of 3 words simple sentences at 3-year-old, not talking like an adult to a stranger at 4-year-old, that child has speech delay. That's what it means. So the question is, why is this child having speech delay? There are many reasons why children can have speech delay. So speech delay is just descriptive. It's not a diagnosis. It's just tell you the child is not talking age appropriately. Now, what is the reason for this speech delay? That is where the question now comes in. So there are many possible causes. Some children just have speech delay. It is just an isolated thing. Every other aspect of their development is fine, but they are just slow talking. And sometimes their family, that's how they are slow talking. It is possible it's actually isolated speech delay, which is unfortunately, that is the only diagnosis people make, that, oh, the child is just going to be slow, but with time, the child will catch up and will be fine. That is one category. But there are also children who have speech delay as part of what we call global developmental delay. So not only the speech delay, they're also slow with walking, they are slow with doing things for themselves, they are slow in their play. So it's a global developmental delay. There are some children who have speech delay that is part of autism. So it's not only the speech that will be delayed, they also struggle with their social interaction. They don't play with other children. They also struggle with repetitive behavior. They also have some sensory behavior. So that is autism. So autism, speech delay can be part of autism, can be part of global developmental delay, can be on its own. Speech delay can occur in children who also have genetic syndrome like Down syndrome or any of those other syndromes. It can also be part of even things like cerebral palsy. So speech delay on its own does not mean it's not the diagnosis. The question is, why is this child having speech delay? And that is where, so speech delay is not autism. There are people who have autism who do not have any speech delay. And that is another myth we need to correct. I think I have to come back for part 2 of this Q&A because I still have lots of questions and my time is almost up. So there are people who are talking there are people who have autism but who never have speech delay, because people always think, oh, but my child is always talking. Why would my child have autism? Yeah, your child can be talking and in fact be speaking like a professor and have autism. In fact, that is it. So it is possible. So it is not everybody who has autism who will have speech delay, and it is not every speech delay that is autism. So there are 2 separate conditions, but autism Most children who have autism will also have speech delay, but speech delay does not automatically mean autism. So if your child has speech delay, you got to see a speech therapist. The speech therapist will do an assessment. Parents, we tend to focus on the talking, the expressive language. Those of us who do assessment, we are not only looking at the talking, the expressive language, we're looking at the understanding, the receptive language. We're looking at the play of the child. Is the child doing pretend play, imagination? We're looking at that. We're looking at any repetitive behavior. We're looking at any sensory seeking behavior. Parents don't even look at all those things. Those things are there, but they don't even say it. But a professional will look at all that. So if a professional assess your child and the only thing there is just the speech delay, the understanding is good, there are no repetitive behavior, that is speech, isolated speech delay, or speech impairment, or developmental language disorder. Don't worry about our jargons. But if the child is having speech delay, we're also seeing the child is not giving eye contact. The child is, not pointing, not waving, not playing with other children, not doing pretend play, not doing imaginative play. The child is spinning around in circle. Those are signs of autism. So we know this is autism. This is not just speech delay. The speech therapist will tell you your child needs to see developmental pediatrician for the autism part of the assessment. So that is just, I hope this is clear. So speech delay is just a description. It's just like somebody saying I have fever. You can have fever from malaria, you can have it from pneumonia, you can have fever from cancer, you can have fever from so many things. So the question is, giving paracetamol alone will not solve the problem. We need to know why you're having the fever so we can address it. So the same thing with having speech delay. We need to know why. Is it part of autism? Is it part of global developmental delay? Is it part of something else? That is all. Even some children have what we call selective mutism, where they will not talk in school, but they will talk in their house. So that is all part of what we do when we do assessment. All right, I will just take a few more questions. I think I just have to come back and address the rest of the questions because there are so many of them. Okay, so this question, did they get violent and destructive? I can understand where these questions are coming from. And the simple short answer is no. Autism doesn't make people violent or destructive. Yes, people who have autism may have some behavior challenges. They can have challenging behavior, just like any other person can have challenging behavior without having autism. I know we've had some cases of people shutting down schools and all sorts of things, and people always want to defend it with autism. There are several thousands, and like I said, 1 million people in the UK on the spectrum. How many of them do any violent behavior? Very few. So it could be part of a challenging behavior, and like I said earlier, it's about understanding why they have those behavior and how to support them. Yes, some children could be destructive of their toys. When they're having meltdowns, they don't even understand where they have they can do things and hurt themselves or hurt other people in the process. So it's about supporting them to understand the cause of that behavior and addressing it, because that behavior is talking. They are trying to tell us something with their behavior by acting out, and we can address that. But autism on its own does not make people violent, does not make them destructive. They can have challenging behavior, which can happen in any other conditions as well, not necessarily autism. And it's about supporting those behaviors and addressing that. Okay, somebody say, please, I want to know the meaning of autism. I think we've already answered that. If you are new, you're just joining me, please just watch the video. It will be available after gone. It will still be there. You can watch it again. I've defined autism and I've explained what autism is. And I think the question most people like, what are the signs that tell you somebody is autistic? So I will talk a little bit about signs of autism. There are signs, so many traits. But before I go into that, let me just quickly sound a note of warning. There is no one sign that when somebody has that sign, it automatically means they have autism. There's nothing called pathognomonic sign in autism. Forget the big grammar. It just means that there's no one sign. There are some medical conditions that once we see that sign, we are 100% sure this is the condition, okay? So there are medical conditions like that, but when it comes to autism, there is no one sign that once you see that sign, you want to make a diagnosis of autism. No. For a child to have autism, the child must tick we have what we call diagnostic criteria. The child needs to have several of those traits that I'm going to mention now, and they must stick in certain area. We have the A, the B, the C, the D, and the E. Those are the diagnostic criteria categories for autism. So the child must have in all of them. It cannot just have only in the A and not have in the B. The A is the social interaction, social emotional reciprocity, friendship, and all that. The child must have issues in that area. The B is the behavior, repetitive, restricted, kind of behavior, where they have rigidity, where they have all these sensory issues and or repetitive behavior. The child must also score in that. So if the child only score repetitive behavior issue but none in the social emotional and all that, we're not going to give a diagnosis. And it must be present from childhood. It's a developmental disorder, and of course the D and the E are not so important, but they are part of it as well. But the A and the B very crucial. So which means that just one thing alone does not make it autism. The child needs to have it across all the different diagnostic criteria. So, what are the common signs? Let's start with the younger children. Eye contact. As early as 7 months, children give eye contact. They call their name, they look at you, they smile at you. Children on the spectrum, they don't care whether you are there or not. But some children can give eye contact and still have autism anyway. So just saying that, oh, because my child is giving eye contact, it can never be autism. That is not true, which is the challenge of giving a list of symptoms, because people will now think, oh, but my child has eye contact, that means it can never be autism. It can still be autism even a child will give eye contact, okay? Sometimes they don't respond to their name. You call them. Some parents wonder, is my child deaf? Then they go and do hearing tests, and the hearing test is fine. So but it's one of the signs. It's one of the questions we ask you in the M chart. Some they don't show their facial expression. Like one mom was telling me, I struggle to get my child to smile in pictures. They just look blank. They look neutral. One was telling me, I can't even get him to laugh. He's almost 3-year-old. He will never laugh. He will never giggle. So you can. The parents, this is a mother that has 3 children, so she knows there's something that is not there. These are some of the signs you may see. They don't play games, all these games, peekaboo, all those things we do with children, hide and seek, boju, all those kind of things. And children like it when you do it. They also want to copy you. They even want to make you do them more. Children on the spectrum, they may not be bothered. They don't even want to participate in that. You throw balls to children, they throw ball back at you. Children on the spectrum may not want to do that. Remember, some may do it and still be on the spectrum. So I need to remind you of that. They don't use gestures. So if a child is not talking, we expect them to compensate by using gestures. So they should be pointing, they should be waving, and all that. They should be nodding their head for yes, they should be shaking their head for no. We may not see those gestures, and that would be a sign that worries about autism. Some may not share in their interest. Sometimes when children get like a sticker and all that, they're always so proud to show it. Mommy, see my sticker, see my auntie gave it to me. Children on the spectrum, they don't even want the sticker. They're throwing it away. They don't, and they're not going to show you to anybody. They don't share their interests. They don't want to share their toys. They may even take it off other children and hold it. Sometimes parents think it's a behavior they start between the children. Please don't be the children. Sometimes they may just be a sign that a child is on the spectrum. And sometimes they don't react. So another child is crying by their side. Other children will just go and rub the child's head and tell them sorries. They don't care. You may be crying and they will just be laughing at you. They don't seem to understand emotion, and they may not even see when you take children to the park or to play area, soft play area, they see other children, they just gravitate towards them. They want to run around with them, play with them. Children on the spectrum, they will just go to their home corner. You take them to birthday parties, they don't want to do anything the MC or whoever is the person coordinating, asking other children to do. They just want to do on their home thing. They're always in their home world, that kind of thing. So those are the signs. They may not want to sing or dance, by the age of 8 months, So they have that difficulty with their social communication and social interaction. That is one part. The second part, which is a big part, is that they have all this repetitive behavior. They may line up toys. They will just line up. See children just put their car. Some of them will even group them according to colors, red, green. Then you also group them according to sizes. So you can see them. Some of them just open and close cupboard, open and close the door, open and some of them spin around in circles. Some of them echo words. They just repeat the same thing. Maybe they hear on the TV, on the program, they just say it over, or whatever you say, they will repeat it after you. You say, how are you? Instead of them saying fine, they will say, how are you, back to you. They just repeat those words, and they play with the toy the same way. So every time you give them the same toy, the same way, some of them will be so obsessed, maybe with a iPad or with a particular car. They always take it in their hands. They want to go with it everywhere they go. Some of them would like to just spin the wheels of the cars. Then when you change anything, you change the TV, they get so upset about it, or you decide that, okay, let's finish, let's go home now. They are so upset about the transition. They just want to keep doing what they're doing. Some of them have very obsessive interests. I know children that they will only gather pen. Some of them, they will like to play with blue tags, They just become obsessed. Some of them, those who are able to talk, they talk a lot about what they're obsessed about. Some of them, I know children who knows everything about dinosaurs. This is a child who cannot speak sentences, but they know everything about dinosaurs, and they can tell you all the different names and types of dinosaurs. I have no idea what they mean. Some of them will know all the train station, all the tube station in London. They know everything about things that you don't expect them to know about, but the common things you expect them to say, mommy, daddy, they can't even do that. And some of them do all this rocking thing, they do all the flapping, all the spinning, or they may have, sensory sensitivity with any loud noise, they're covering their ears and all that. Those are the repetitive restricted behavior that you can also see in autism. So I will end this session by talking of how do you support a child who is on the spectrum. And so when it comes to autism, we don't have a drug. We don't have something that once we give it will go away. I really wish we do, which is what parents want us to give, but we don't. So autism is a management thing. We support the children. And like I said, we support them with what are their needs. The child is not talking speech therapy, behavior issue, behavior therapy, sensory issue, occupational therapy. So that is why it is so important for us to go for assessment. So I just want to encourage us, if you have been listening to me and you've seen any of these little signs, or you have concern, first you can go online, just search for Autism Speaks. They have what we call M-Charts. It's like a screening tool for children between 16 to 30 months. There are other screening tools. You can just read online. They will give you a feedback straight away. They will tell you whether your child is showing lots of signs of autism. And immediately they show you, they will tell you, you need to take your child for assessment. Please take your child. Don't self-diagnose autism. Take your child for an assessment by a qualified professional, usually developmental pediatricians, child psychologists, speech and language therapists. Those are the people that most of the psychiatrists as well trying to do an autism assessment so that they can do a proper assessment. And an assessment is not complete without a report and without a plan of how you're going to support your child. So if you still have any question about autism, head over to Ask the Pediatrician Facebook group, ask your questions, and I will answer them. And I'm still going to come back because I still have lots of questions I've not answered. So I'm going to do a part 2 of this Q&A session on autism spectrum disorder, and to see how we can support our children. And I'm happy that many of us are becoming more aware, but please, let's seek help early intervention helps. Thank you so much for listening to me. I will see you again next week, where I'll be taking part 2 of this series. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.